My name is Samantha Davis. Today is the 10th of May 2013. The purpose of this video is to demonstrate 5 clinical skills and our communication skills. The 5 clinical skills are palpating a radial pulse, measuring a respiratory rate, palpating and auscultating a blood pressure, auscultating a chest, and establishing a GCS score. Today we'll use standard precautions of gloves and goggles for all these skills. Hi, my name's Sam. I'm from Ambulance Victoria. What's your name?
My name's Mrs. Jones.
Mrs. Jones, how old are you?
I'm 78 years old.
Okay, I just want to take some vital signs today, if that's alright. So I'm going to start by checking your pulse, if that's okay.
Okay.
So I'm just going to place 2 fingers across your wrist.
Sure.
And count your pulse for the next 30 seconds.
Sure.
So Mrs. Jones's pulse for 30 seconds was 36, which gives us 72 beats per minute. Now I'm going to check her respiratory rate for the next 30 seconds by watching her chest rise and fall. Normally we wouldn't let the patient know because this could alter their breathing, but today we're just going to watch her chest. Thank you, Mrs. Jones.
That's okay.
Everything looks alright so far.
Very good.
So the non-verbal communication used then was like the touching of her wrist. I asked permission and we made eye contact. I'm sitting towards her with an open body posture showing interest, and the tone of my voice is gentle and genuine. Her respiratory rate was 16 beats, 16 breaths a minute, which is within the normal guidelines. So demonstrates that she's not in any respiratory distress or breathing heavily. Okay, so is it okay if I take your blood pressure, Mrs. Jones?
It's okay.
Have you ever had it taken before?
A few times, a fair while ago.
So firstly I'm going to pop this around your arm if that's alright.
That's okay.
Yep, that's not too tight, is it?
No, that's
No,
fine.
just pop your hand up like this.
Sure.
So now I'll place 2 fingers across her radial pulse and inflate the blood pressure cuff up to when I can no longer feel her pulse, and then go 20 above. It's not too tight, is it, Mrs. Jones?
That's okay.
No? And I'm going to slowly deflate it until I can't feel, until her pulse returns. No. Pulse returns. And then that will give me my systolic reading. So her systolic reading was 110, which is good, it's above 100. Now to auscultate her blood pressure. I'll pump up the blood pressure cuff to 130, so a bit over 110 what we got the first time. And I'll slowly deflate it until I can hear her systolic beat. And when I can no longer hear her pulse, that will give us our systolic reading, which is 75. So your blood pressure is very healthy, Mrs. Jones. It's within the good range.
Oh, good, good.
Which is a good sign. I'll just take this off.
Sure.
Thank you.
Thanks.
So our non-verbal communications there were the use of touch. I was gentle when I put on the cuff. I wasn't too rough with her arms. This use of silence when I was listening, so it showed I was concentrating and I was listening hard to get the correct reading. Again, I'm facing her with an open body posture, and the tone of my voice is caring and intentive on finding the readings. So Mrs. Jones, do you mind if I listen to your chest?
That's okay.
Do you want to is it okay if I lift up your shirt?
That's
Yeah?
fine. Yeah.
Okay, now can you lean forward for me please and take a couple of big coughs? So I'm going to pop the stethoscope on her back. I'll start at the left side and just take 2 big breaths in to the right side so I can compare that each lung is operating the same. Last one. So I listened from the apex of Mrs. Jones's lungs to the bases. Left was equaling right, and there were no signs of wheezing or crackles. So your lungs sound good, which is good. It means
Fantastic.
breathing very well, which is good.
Good.
The non-verbal communication used there were, again, touching. I asked her permission before lifting up her chest, and I was gentle with the stethoscope. The tone of my voice is gentle and caring again. The use of silence when I was listening, so that I was interested, I wasn't just talking over and pretending I was listening. And the proximity of me to Mrs. Jones, some people would be uncomfortable with that, but she allowed me to touch her back and lift her shirt. Now we're going to give Mrs. Jones a Glasgow Coma Scale score, which is scored out of 15. The first element of this is her eye movement. Mrs. Jones has spontaneous eye movement. She's looking at me and she's noticing things around her. So she scores a 4 for this section. The second part is her verbal responses. So to find this out, we ask normally 3 questions. So can you tell me your name?
My name's Mrs. Jones.
Mrs. Jones, what are you doing here today?
I'm just having a few tests done.
A few tests done, and what year is it?
2013.
2013. Yep. So she's given us orientated and comprehensible responses. So she scores a 5 for this section. And the last section of the GCS score is the motor responses. So to find this out, you normally pop your fingers out and ask her to hold on and give them a bit of a squeeze. So you're able to hold on to my fingers, Mrs. Jones, and give them a bit of a squeeze?
Okay.
Yep. So she was able to obey commands, and she was able to squeeze my fingers tightly, so she scored a 6 for this section. This gives Mrs. Jones a overall Glasgow Coma Scale score of 15, which is the optimum score, so she is conscious and aware of her surroundings. In this section, the non-verbal communication techniques used were eye contact. I looked at her when I was speaking. Touch, again, when she grabbed my fingers. Open body posture, and the tone of my voice, which is interested and